Welcome to Roadmap to Joy. I'm Jake Sparks, the Embark Treatment Director, and I have here with us today, very lucky to have Miss Abby Jones, who is a licensed marriage and family therapist. She is our clinical director of one of our clinics here located in Scottsdale, and we're very excited to have her on today. Welcome.
Awesome. Thanks for having me, Jake.
Yeah, anytime. Today's topic is one we're very excited about. We get lots of questions about mental health and where do I even get started and how do I understand all of this? And often in our videos, we're referencing other things. So today we're going to try to break it all down really from the beginning. So today is our Mental Health 101, where we're going to try to just help unpack a lot of the questions people have and help us all to get going and get started.
Awesome.
And Abby's here to help walk us through it. So kind of one of the first questions that people always ask is, how should I be thinking about mental health? What does that refer to? Is it just feeling good? What does that actually mean when we say that mental health?
Yeah, sure. I mean, I think that's one of those things that you hear, but we don't always know what it means. And the way it's depicted in movies or TV shows or in media can sometimes feel scary or overwhelming. But really, mental health is just like the emotional and psychological and social well-being of someone. It kind of impacts how we think, how we feel, how we behave, and how we engage with ourselves, as well as how we engage with others.
Yeah, so there's a lot of, sounds like the emotion built in, some of the cognitive process, and then you really hit on how we engage with ourselves and others. Because I don't know that we always think of mental health as a relational thing. Anything you might say to that?
Yeah, I think we don't exist in a vacuum. We're social beings. Even if we're totally isolated, that tells us something about how we're doing, right? Even the separation from others is information about how we're feeling and acting and engaging. So I think when we think about mental health, it's in the context of community and relationship and family and self.
That's really helpful because I wonder how many people show up for mental health concerns when there's also relational issues. And if relational issues aren't a part of the problem, they're certainly a part of the solution. Like none of us can make it through alone. I love your thought. We don't exist in a vacuum. So one of the questions a lot of folks have about mental health is, so let's say I have an issue with a tooth or something, and I need to get a cavity filled. It doesn't really matter where I go to the dentist. The process for getting your cavity filled is kind of the same. There's just a way to do it, and the dentist just does it. So a lot of people, or especially we get asked by parents of, well, what's the treatment for my child sneaking out of the house at night, or refusing to go to school, or not coming out of their room, or maybe self-harm, or what are the treatment for each of these little behaviors? And so they're wondering, I know I need something, but how do I know which treatment to match up with what symptoms we're seeing?
Yeah, so you're going to want to start by looking for a licensed professional. So getting connected with a licensed therapist. We talk about psychotherapy specifically, probably like a massage therapist or a physical therapist isn't going to be super helpful for more like behavioral, relational, and mental health needs. There are different types of therapy. You can do individual, family, group. And the thing you mentioned, like going for a toothache, you wouldn't necessarily show up in the emergency room immediately, right? You would start by going to your dentist. And so we want to start by going to a therapist. They can be in private practice or group or in an agency. So there are lots of different avenues for seeking help, and that can be overwhelming. You can go online and read Google reviews or Psychology Today. Word of mouth is helpful as well, but really looking for someone that is trained in the areas that you're seeking help and support in, someone that's licensed and someone that has like that good relational fit. And it's okay to call and seek to find out if it's a good connection, because that relationship with the therapist is really important, and you want to make sure that you're feeling like connected and supported, and that you can like trust and open up with that person.
So yeah, there's a lot packed in there. Some really great advice. So you said you should have a therapist, a licensed therapist, a credentialed professional, and then how do I know if this person has an expertise treating the specific issue myself or my child's going through? Like, does this therapist have experience with self-harming in the bathroom, or, does that make sense? Like, there's all these hundreds of symptoms. How do I know if my therapist has the expertise to treat my symptoms?
Yeah, it's okay to ask them. Sometimes we think like we maybe can't ask them questions. They're just supposed to tell us things. But it's okay to ask and say, hey, are you experienced in this? Can you help us with this? Like, have you had similar clients to us? And a good therapist is going to be willing to share like their area of expertise with you.
Great. And then what are some of the names? It's kind of baked into the name, but not. It might be helpful to still spell it out. So individual therapy versus family therapy versus group therapy. How do I know which of those I need? And what maybe just start by giving us some examples of what might be different between those.
Yeah, certainly.
Since you brought it up here.
So individual therapy is kind of what it sounds like. It's that one-on-one. Maybe you've seen on movies where someone walks into the therapist's room and they like lie on a couch. That's not necessarily what that's going to look like. There's a thing called psychodynamic. They may do that, but for the most part, it's going to be more like talk therapy, where you're having a conversation with someone. They're helping you reflect. They're helping you really gain some insight into the how, the why of what's going on for you. It's not like a friend. It's not someone where they're going back and forth and disclosing things about themselves, but they're helping support you navigate what's going on like interpersonally for yourself and in relationships. So that individual therapist, like typically it's like 50 minutes, typically is a individual session. A lot of times it's weekly, maybe bi-weekly. And you're a lot of times focusing on the way that you're showing up in your relationships and also like how you're feeling about yourself. Family therapy, I am a family therapist, and so I'm a little biased towards that.
Good, own your bias. That's, as am I, so I'm preaching to the choir here. Yeah.
So I think family therapy is so important because so often, especially for teens and young people, there's a lot of conflict or a lot of dysregulation that's happening in sibling sets or with parents, and we're not feeling like heard. And so family therapy can be a great way to process those relationships and how we're existing as a family system. Siblings may involve parents. You can bring in different parts of the family unit to address like what's going on, because people aren't the problem. Like the problem is the problem. And so it's really making sure like we're not saying, hey, like fix my kid. It's really how do we fix this relationship and how do we help support what they're going through and healing that together. Yeah.
So I think there's this idea out here that you mentioned the problem's the problem. And sometimes I've even heard parents say or tell their kids, hey, if you don't shape up, you're going to have to go to therapy.
Yeah.
And it almost starts to be like a punishment. So therefore, if you are a part of therapy, it must be because you are a problem.
Yeah.
And I've even experienced some parents or family members being really aversive to therapy because they're like, well, I'm not the problem. My kid's the problem. So why would I need to show up to therapy? Because I think therapy equals problem person goes to therapy. What would you say about that?
Yeah, gosh. I mean, I think so much of that is like that stigma with mental health. And so it's helping shift some of that, because if you have a toothache, you're not like upset that you've been bad, or you haven't like done a good job with your teeth cleaning. You're like, oh man, I need to get this fixed. So I would say, like, let's externalize that from like something wrong with a person to like, hey, this is the way that we're existing together, and like that is something we want to change, not necessarily like maligning the person and making them bad.
Yeah, I love that analogy because of the toothache. I think I think that's great because that's part of being human.
It is.
And you have to go to the dentist, and most people spend more time brushing their teeth every day than they do thinking about their own mental health and wellness.
Yeah, and you also like go to the dentist or the doctor kind of sometimes for like a routine checkup. And that's okay, like to think about therapy and mental health that way as well. It's a good opportunity to check in and say, hey, maybe this is interfering in my life in a way that doesn't feel great, and I want to like tune up and improve things and have better functioning, healthier functioning for just the way I feel as well as the way I engage.
Yeah, that's a much more, I think, productive framework of saying, as a family, let's go to therapy because we want to improve and we want to grow together and get better versus who's ever the baddest or naughtiest kid or member of the family, let's ship them off to therapy.
Yeah. And really, if like they're thinking about something more than an hour a day, or like you've adapted your life or adjusted the way that you're living to avoid or to get around this problem or this thing that's not feeling good, then that's probably an indicator that like checking in with a therapist would be beneficial.
So we have individual therapy,
Yep.
family therapy, which I think we'll dive a little bit more into, and then group therapy. Yeah. So how do I think about what group means?
Yeah, group can be so helpful. And sometimes maybe we think it's not as helpful as others because you think like, oh, one-on-one would be better. But as we talked about earlier, like we exist in relationship. And so group, there are different types of group. It may be skills-based or psychoeducational. It could be support. Also learning more like cognitive behavioral strategies. So you can look at different types, and then also interpersonal process. And in group, you have this like restorative emotional experience a lot of times where the group members can help process with one another and reflect back. And you can also practice in real time how to develop some of those coping skills and interrupt what's going on in the moment in relationship, and then it can mirror back into your life with your family members and friends.
Yeah, love that vicarious learning.
Yeah.
If I'm in group, I can learn from the successes and from the weaknesses of my group mates as they're learning from me. So I don't have to go through and live everything myself. I can, and then I've also heard people say that it actually helps them to be more reflective of themselves because they can see themselves. Part of me really resonates with what she said, but I also really feel connected to what he said over here.
Yeah.
And so it can be a really reflective process, particularly with groups as cohorts are, similar age, maybe similar presenting problems, those ways.
And that's a great point, Jake, because you also have like that in the moment feedback.
Yeah.
And so there's also opportunity for like social skills development and also all kinds of good stuff because you can sometimes get into group a little bit more quickly than maybe an individual therapist at times. And you can do group skills learning and in conjunction with family or individual therapy as well.
Yep. Okay. So I could choose one of the three or combinations of the three, depending on what I might need.
Choose your own adventure.
That's right. Okay. Typically understand that if I'm finding a professional, they'll also help me navigate maybe what I might need for myself or for my family.
Yeah. And it's not typically recommended to have more than one individual therapist. That would be like a little unethical because maybe they're having different ideas about things or coming from a different framework. So you want to have like that one kind of trusted person for the individual, and they can help create a treatment plan or a roadmap, if you will, of a path forward for healing.
Great. Sometimes when we work with parents, they're like, well, what's the cure for this? If my child has depression, can't you just give them the antidote to depression? Or can't we just operate and get this anxiety out of their body? And we really want to just target symptoms and just root that out. And sometimes that leads people down the wrong path. I'm wondering if you can share a little bit about that.
I think a lot of people are looking for like that magic wand, or in mental health, even like that magic pill where things will suddenly be resolved. Really, when we're talking about psychotherapy, we're not treating just symptoms. We're really wanting to get at like what's underlying those symptoms that can be driving it. Sometimes it's shame or an unintegrated sense of self. Sometimes it's dysfunction in the way that we're engaging. So if you're just treating symptoms, sometimes that can be more like whack-a-mole, where it's just moving from like one dysfunction to another. So in therapy, we really want to think about behavior as like the smoke, and really like that interpersonal process is underneath is like the fire, and so we want to go towards that.
I see. So there'd be some indicators that something's going on, right? I've heard someone say the symptoms are the fire alarm, and we maybe like might be prone to just that alarm's annoying. Let me just turn off the alarm, but not pay any attention to the actual fire going on. So you're saying these symptoms kind of arise but they're probably indicators that something deeper is happening.
Right. And it can be, mental health is not a nature or a nurture. It's both and. We are impacted by some like predispositions biologically, but also the way that like we're engaging with others. So it's there can be it's important to have like an approach that takes all of that into account.
One of the things I've experienced is we are used to, especially in our Western world, we're really used to there being a cause and effect. If someone comes down with a disease, it's, well, where did we get the disease? Where did it come from? Let's just root that out. And one of those reasons I think people struggle with mental health is there's a million different causes and there's a million different symptoms, and you and I might live through the exact same scenario, and you develop anxiety and I develop depression. Or we both develop depression, but it looks different for you than it does for me. So there's really not the same cause and direct effect. It can really be so individual for each person as they develop those symptoms.
Yeah, that's so true.
I'm wondering if there's anything you might say to how one symptom develops versus another. Why does someone have a symptom of self-harm where someone else might have a stronger symptom of like perfectionism and anxiety and having to perform well at school?
I think it can be dependent upon like some of those predispositions, but also adaptation in your environment. Sometimes we go inwards and direct some of that anxiety or some of the negative thoughts towards self and more of that internal. And other times people may adapt more towards like an external, where you may see like they get bigger and louder and maybe more angry. And sometimes we can see that and think, oh, these are really different, but what's driving it may be the same. It just depends on if it's like more of an internal versus external expression. Yeah,
so you're saying some of it might be, earlier you said nature and nurture. So we all come hardwired, and then we're met with an environment, and we all have our own personalities. So you might internalize things, and I might externalize them.
Yeah, and we maybe are receiving different messages around what's okay. And what's okay in my family system may not be in yours. And so I may be more predisposed to hide something or to try to live up to what I think people are expecting of me. And in another person's environment, other systems are at play.
Yeah. Your needs might be different than mine.
Yeah.
And so your symptoms might be, sometimes, I think you've mentioned this before, talk about trying to adapt to a maladaptive environment. So if your symptom provides a need for you, my symptoms might meet a different need for me.
Right.
Okay, so we understand a little bit about here's how to get started, really trying to set the stage for how to think about symptoms, different than what we're used to if you just go to your medical doctor or your dentist. There's a wide variety of symptoms. I'm wondering, how will I know if myself or someone in my family needs therapy? That seems like a big step to take, and there's this kind of edge where people are like, oh, we're doing okay. We don't need therapy yet. Or I talked to someone once and they said, I try to help. It was an educator. They said, my job is to help kids so they never have to go to therapy. And so I thought, oh, what's wrong with going to therapy?
Right. Yeah, that's interesting. I think it would be so great if we could shift that.
Yeah.
Because one thing I've heard from people so many times is, gosh, I wish we did this sooner.
Yeah.
And I've never heard anyone say, I think I started therapy a little bit too soon. Things weren't bad enough yet.
I was a little too ahead of this, and we didn't really get to get our hands too dirty because we just nipped it in the bud. Yeah.
Yeah.
How can someone know if they should be seeking it?
Sure. If you're experiencing distress, even if it's something that you feel like is normalized, but it's impacting your life and it's intervening in like your day-to-day functioning, even if it's like the way that you're thinking about something, like that's probably a good time to go towards a therapist. If you're experiencing things like changes in sleep or eating, if you're noticing a change in your energy or a change in the way that you're interacting with others, maybe isolating or pulling away from. It could even look more like you're going more towards relationships and that are maybe unsafe or unhealthy. Like if you're noticing a change in the way that you're showing up and it's impacting you, that's a good indicator to go towards therapy.
That you would need something. So you're really highlighting this change. I feel this shift. What's happening right now? Noticing a change. What are the changes one might start to notice? You mentioned sleeping and things like that, but
yeah, if there's an increase in maybe maladaptive coping, so like if you're increasing in smoking or drinking, or if you're seeing more like risky behaviors in your kid, where they're engaging in like more like unsafe conversations on the internet or spending a lot more time on their phone. If you're seeing like a sense of hopelessness or feeling numb, a lot of times people are saying, well, I don't feel hopeless. I don't feel great. I just feel nothing. Like, in therapy, we call that like anhedonia, the sense of like you've lost a sense of enjoyment of things you used to enjoy.
that's a really interesting part because you said first you identify. If you start to notice some changes, that might be a clue something's off. But I do think you're also hitting on something now where some people are like, well, is this not normal? I've just lived this way. Do people get excited about this? Right? Like they've just lived this way for so long, they might not realize. Or I've talked to people who have had maybe toxic relationships. They've never experienced a really healthy caregiver.
Yeah.
So they don't know that that's even an option. So they kind of get stuck in that. And then maybe don't seek out help because they just think that that's normal.
Yeah. Yeah, that's a great point.
Yeah. I'm wondering if there's any other lies people tell themselves to talk themselves out of therapy. So I know a big one is like, well, I got food on the table. I have a house. So many people have it worse than me. Who am I to feel this sad and depressed? I have nothing to feel sad about. So they just ignore it.
Yeah, that comparative suffering.
Yeah.
That's okay. And like, that's terrible for those people. And it's okay that it's terrible for you. Each of us is like worthy of a full life with zest and enjoyment and a sense of hope and belonging. We're wired for connection and we're wired for relationship and being okay in our skin.
Yeah.
And if you're feeling like uncomfortable in your sense of self and you're feeling like maybe this isn't for me, like I think that actually might be telling you it is.
Yeah. Great point. And I think people forget about it develops over time and it changes. So that's okay too, to have to see that growth or progression. Or we were doing okay when my kids were little and we were coloring books, but now that they're in junior high and going to dances, like, oh man, what's happening here? And I think it takes some people by storm.
Yeah, and you're bringing up that sense of transition. That can be a huge time to like tune in and say like, hey, let's get some support here. Moving from middle school to high school, the like relationships change, the homework expectations change, like everything that's going on is different. You're in a new environment. Maybe your kids are growing up and leaving the house, and like suddenly it's like, man, where our relationship dynamic has shifted. You're moving. That can be so hard. I recently did that.
Yeah.
And so anytime you have a big change in your life, like a new baby, those can be times to check in.
Yeah, that's a great point. We probably underestimate the impact those things have on us, and like really valuable to take some intentional time to step in and watch what you're doing and how you're feeling. So we kind of understand what why we might need therapy, how to go out and get one. So I'm wondering if we can just talk through some of the types of therapy, or what does actually therapy look like, and start to feel like. So broad question, what is psychotherapy? How do you define what that even is?
Yeah, it involves communication between a client and a licensed, trained professional to help resolve problems or help feel better. Psychotherapy helps you find relief from emotional distress, and it can help you modify ways of thinking and behaving and believing about yourself and about the world. It is a relationship that can develop over time. And it's something that you don't just go one time and expect like immediate change. It took a long time sometimes for things to develop. And so it might take a little bit of time for things to start to shift. And so you want to keep going towards it and engaging.
How would my psychotherapist be different than my best buddy? Right?
Yeah.
Because I have a good relationship there. I call him up on the phone and spill my guts to him.
Right. That friendship with your best buddy, it's more back and forth, and maybe like you take care of one another, sure, but your friend's going to give you some advice, and then maybe they're going to share how they're feeling. But a therapist is trained in specific ways of meeting you with empathy and with curiosity. A psychotherapist is going to be trained and held to an ethical standard. Therapists are bound by confidentiality. They have they're licensed and regulated by their state, and there are a lot of things in place that help protect you as the client, but also you can trust that they have like your best interests at heart, and that they're gonna listen and reflect and help you.
I like what you're saying, because one of the misnomers of therapy is this idea of advice giving. That the therapist sits there and has a clipboard and has a PhD, knows all the answers, so they can just dispense the perfect life advice. And then clients show up to therapy, and sometimes they're disappointed when, like, she didn't just tell me what to do. What's going on?
Yeah.
So how would you describe the process of therapy versus my buddy might just say, Jake, knock it off. Do this instead.
Yeah.
And dispense life advice, but the therapist, that's different.
Yeah, and there can be different styles. Like some may be more directive or indirective, but really it's helping you discover like what works for you, and helping you peel back and solve some of your own questions, and be curious about what's going on without telling you specifically like do this, because it may not work for you, and what your best path forward may be different than someone else's, and so they're just really helping you reflect and discover. It's like peeling back onion layers.
Someone once described it to me is like, if you have a really messy garage with lots of just stuff that you've collected over the years, and a therapist is someone that is an expert in organization, and they can help you unpack and move and say, well, these boxes should go over here and these ones here, and let's help. Maybe if we have some organization, and they just help you kind of clean up your mental and emotional space, but they still say, it's your stuff.
Yeah.
And you got to figure out how you want to organize it, but maybe I can help organize it with you.
I like that.
And I think that helps kind of set the stage of like, ultimately, this is my stuff that I have to take with me to therapy and sort through and find some resolution in. And that way it's actually empowering for clients, because it's not just some expert telling them what to do.
Yeah.
Here's what to do with your stuff. It's more, you got to figure this out, and I'm with you.
Right. I like that. I've heard something similar of people think therapy can be like a mechanic shop where you drop someone off and they get fixed. And it's really more like Home Depot of we've got tools and we believe like you can do it and we can help.
Yeah, that's great. Home Depot. There's some other professions that are like coaching. How would you talk about coaching versus therapy versus your buddy down the street?
Yeah, so in the recent years, coaching's become way more popular, especially online, like Instagram, TikTok. Like there's tons of mental health coaches that say they can help you improve your life. Therapists are licensed and regulated. They're trained specifically. They're able to diagnose and treat specific mental illnesses or mental health needs, and also relationship needs. They can help delve into your past and help process and resolve things, whereas like coaches maybe have some training in some areas, but they're really focused more on setting goals and working to achieve them versus like processing and really finding like healing.
I see. So a coach might say, from this time going forward, I can help you strategize around some concrete goals, whereas a therapist might say, let's dive into your past and make some resolution and peace with the past so that you can move forward. And there's probably space for both depending on your issues or presenting problems. Again, the danger, though, is that we don't want to just turn off the fire alarm while let the fire still rage. Like, I'll just set better goals and move forward and pretend all this stuff in my past never happened. But it can feel like just shutting off the alarm and pretending the fire doesn't exist when it does.
Yeah.
When I'm coming to therapy, I'm looking for a therapist. I know the types of therapy, I know the presenting problems, but I am not an expert in all the different types of therapy. And it is, if you're just joining this world of seeking therapists, it's a lot to decode, often literally, because it's just acronyms, DBT, CBT, and LPC, and MFT, all of those things. So I'm wondering if we can just kind of walk through, maybe firstly, what are some common types of therapists, so licensure types, so I might know whom I need to work with, or like what counts as therapy and what does. So just walk through that a little bit. So there's a few things that I've seen. I've seen an MFT or an LMFT. I know what that one is because that's what I am. But maybe you can talk about that a little bit.
Yeah. So we're both MFTs, and so what that means is we're going to come from like a relational model and a relational perspective. So when we're thinking through like issues, like maybe you're feeling anxious, we're going to be thinking through like how does that anxiety or that behavior impact like social and relational context, and we're going to think about it more through that context of the system or like the family system. So MFTs don't just see families; they also can see individuals or your family or your teen, but they're going to be thinking through typically like in a more systemic relational perspective.
So they might say this is a symptom is the family has the problem is a family has the presence of this symptom in it, and it's a family issue that maybe one person is owning and enacting, but they're adapting. That behavior is an adaptation to the system.
And like the environment.
So that's what you'll get from an MFT. So how does that differ from like social work or LPC or
Yeah. Social work sometimes can be more focused on like resources. And so that may be resources that you have internally, like your ability to cope, but it also could be focused in the context of resources in the larger community. So helping navigate through, it's hard to feel really great if you're not sleeping well because you don't have an adequate place to live. And so social workers often think through problems or issues in the context of accessing like resources internally and externally.
And if I understand right, some social workers are not clinicians. They can still act as a social worker, but they're not necessarily providing therapy. And other licensed clinical social workers have specific training of here's how to provide one-on-one talk therapy or family talk therapy.
Yep.
So an MFT and a social worker, those are both master's level clinicians. And then similar with, it's called different things in different states, but LPC or LCPC or depending on where you are, what would I expect from that person?
Yeah, so like a licensed professional counselor, a lot of times is going to come from a perspective of struggling with like a developmental issue. So meaning that something along the way hasn't quite been resolved or supported in a way where the person can live most fully or their best life. So it could be thinking through like an individual issue, less about the system or the relationship, but more about a single person.
I see. And I think there's probably worth saying that there's a lot of personalities between these two or each of these licensures. These are just broad strokes we're painting with what types of general frameworks that education provides.
Sometimes it can just be the philosophy that underlies the specific degree. But I know my friends that are LPCs took marriage and family classes, you know, and so there's a lot of cross-training. And sometimes when folks are initially going to school, they don't even necessarily know the difference. So it's really seeking to more about that relationship with the individual person than a specific licensure.
So your advice would be to not pay as much attention to the letters behind their name as to the person and
their personality and the type of therapy.
Yeah.
So then where does a psychologist fit in, and then a psychiatrist, because those all get therapists, psychologists. I see people interchange those all the time.
Right.
So where would a psychologist fit into this?
Yeah, so psychologists have some different training than our social workers, our mental health therapists. They are often able to do some like assessments and testing, and they can help really help get a more thorough diagnosis and do some more diagnostic testing. Sometimes the psychologists come from more of an approach of rooting out the dysfunction and providing a diagnosis for it. And then psychiatrists, they're medical doctors. And so they've gone to medical school, they've done rotations, and a lot of times psychiatrists will work in conjunction with the therapeutic team, may that be the psychologist or the therapist. So they're often prescribing medications and helping navigate that side versus providing therapy.
Great. So your traditional talk therapies, probably some of these master level clinicians. Certainly a psychologist can provide testing, assessment, diagnoses, in addition to talk therapy, talk support. And then there's psychiatrists that prescribe meds, but then might also do some talk type therapy. I would assume you would want to find if your psychiatrist is doing that, they have some experience and background, because the process of psychiatry might not supplant the process of a regular talk therapist.
Right. And what's really interesting is research suggests that for anxiety disorders, that therapy can often be more effective than medication. And so we want to really make sure that we're using the right combination of tools to treat the individual person, because it sometimes we can find that the combination of medication and therapy, like that may be the winner for a specific child or family.
Where can people find someone? Like, if I need to find someone today, where do I do that?
Yeah.
Yelp? Like, is that where people are going to? Just something online?
I haven't heard that people are going to Yelp, but maybe. Like most things, Google is a place where a lot of folks start. That can be overwhelming, because then what do you end up saying? Like, oh, I want the person with the best website. Like, I don't know. Google reviews obviously can be helpful, but really going to online, Psychology Today, calling a trusted professional, seeking out referrals from your other medical providers or from friends, talking in your community is a good place as well.
I think that's great, because talk to if it's for your child, your school counselors probably are used to referring to people, the professionals. You have other community leaders. Big question for families is, are you paying out of pocket or insurance? And if you want insurance, then you can call the number on the back of your insurance card and find who's in your network. But they can be a lot to weed through and to explore.
Yeah.
One of the things I love that you said, though, it's okay to test them out. It's okay to ask them questions, and it's okay to try to assess the fit, because you would say the thing that matters most is
that therapeutic relationship. Yeah.
How well you're going to work together is probably most important in terms of your long-term health and healing.
Do I believe this person can help me? Do they believe I can be changed?
Yeah.
That relationship of how we're engaging is so important. Because if I don't trust my therapist, then it's going to be really hard to be authentic and transparent and to really be vulnerable to what's going on.
Great. Is that the only option, to call a therapist? We've talked a lot about how to find a professional, but it's like how to find a dentist versus brushing your teeth. Both are important.
Right.
But what's the brushing your teeth of mental health?
Great point. Yeah, I think going for a walk, disconnecting from screens, taking time to show up in relationship, and slowing down. Man, we've been so busy these last couple of years, and it's just, there's been so much. And so it's okay to hit pause, slow down, evaluate. Journaling can be a really wonderful way to reflect and to process what's going on and just get some of that out and onto paper. There are so many strategies that we can do to help take care of ourselves. Connecting with other people can be so important. Giving someone a hug. I think we've been touch starved since the pandemic, right? So connecting with others. Volunteering can be something that
Yeah.
actually is a really powerful
Yeah.
way to improve mental health and connection.
I love that you talked about that, because I think if you say, how do you promote physical health, people would say, oh, well, you can exercise and drink plenty of water and sleep and those really basic things. But those are all very proactive, intentional things that you have to do that don't always feel great. Like, it would probably, some of us might prefer to sit on the couch and watch TV than go for a 30-minute walk outside. Yeah. And sometimes with when we talk about mental health, we forget that it takes work. So one of the things, in addition to like all of those things you said, they take some intentionality.
They do.
If you just check out and like, I need a mental health day, and then you just sit and do nothing, that's probably not actually improving your health.
Yeah, we got to ask that question: am I numbing? Am I like disconnecting and just like vegging out? Or am I being more proactive towards restoration? Like, there is a difference between staring at a screen, watching like 5 episodes of whatever just dropped on Netflix, and restoring my cup.
Yeah, particularly with, I think, mental health, because so many mental health disorders develop as an attempt to be rid of the emotion. I don't want to feel this, so I'm going to do a symptom. I'm going to skip school, or I'm going to use drugs, or I'm going to enact these behaviors to help me feel better because I don't like how I'm feeling. So I think you're right on. Sometimes we accidentally think we're doing self-care, but really we're just avoiding.
Yeah.
So one of the basic points, I love that you mentioned this, so if you want to address your mental health, how are you sleeping? It's pretty hard to be mentally healthy if you're not sleeping. Are you getting enough water? How's like your basic diet? Going on, you don't have to be an ultra marathoner, but going on a 20-minute walk a couple times a week. There's a lot of research that says that's at least as effective as some medication for anxiety and depression.
Yeah.
Really, the takeaway is we do want for folks to reach out to therapists and to seek help. And how do we take control over our own mental health by being thoughtful and intentional about it?
Yeah, absolutely. I heard something one time where we're like overgrown houseplants, where we need sunlight, we need water, we need nutrients.
Yeah.
And our mental health is so tied into like our physical health. They really are so much of the same thing. And so taking proactive steps.
And then I love how you've talked about the relational component, is that we can't be mentally healthy and relationally unhealthy. That's not ever going to work. But building healthy relationships takes time and energy and practice. And sometimes we're doing great and sometimes we're not. And we have to repair and get back on track. But I love how you've talked and really set the stage for this relationship, providing the foundation of mental health. And so reach out, call that friend, take some time, write a thank you note, express gratitude, all of those things to help build bonds and connections.
Yeah.
I think are lovely advice that sometimes we forget about.
Right.
So we've covered a lot of ground. We've talked about kind of what is mental health in general, how you might know if you're needing some really more intensive support and help through a therapist. We've identified what types of therapists might be, and then even where symptoms might come from. And then lastly, we got to talk about how to take your mental health seriously for yourselves. So I appreciate your thoughts and time and being here, Abby, with us. Thank you for listening and being here. This is part 1. Join us for part 2 of our Mental Health 101 series, where we'll break down specific types of therapy and specific methodologies and get into this a little bit deeper. So don't forget to subscribe to Roadmap to Joy wherever you get your podcasts.